Do you look decent? Do I look decent?
I hope so. I spent time.
Did you? Yeah.
You think I just wake up like
I'm
this?
I'm not saying you did it. I'm just saying like.
You think these lashes are mine?
I'm sorry. What's going on, everyone? Welcome and thanks for tuning in to Allied Health Mentors. My name's Eddie, and today I'm sitting with Stacey Palamera. I said it right? Stacey
Yes.
Palamera, who is an old friend of mine who I've known for over 10 years.
A lot of years.
We're getting kind of old. We both went to Robert Frost Middle School in Granada Hills, California. So shout out if you went to Robert Frost Middle School.
And Silmar.
And we went to Silmar High School together. I think we had like one class though out of all 4 years together.
It was such a blur.
Yeah, we went to one class I think together. So we've kept in touch over the years. I think we met in 7th grade, and I was kind of like the annoying kid on the bus, and Stacey was the kid that was like, I'm not having any of that. So we're friends now, though. It all worked out. So the reason I have Stacey on here, if you're just tuning into the channel, this is Allied Health Mentors, where we talk about allied health professionals and allied health career fields. And so the whole point of this is to bring exposure to different allied health professions. And Stacey is finishing up?
Yeah, I'm about to graduate.
She's about to graduate from her sonographer program.
Sonographer, but it's
Sonographer,
ultrasound.
I'm sorry.
Yeah.
Sonographer program. So would ultrasound tech be the correct term?
It's actually Diagnostic Medical Sonography, but ultrasound tech is what.
That's like in layman's terms.
Yeah.
Yeah.
But we don't like to use it because it downgrades our
Well, see,
our
and that's why
profession.
we have these conversations so that we know like what's the proper
So
terms.
most people say ultrasound tech, but we like sonographer better.
Sonographer? Okay.
Yeah.
Sonographer. I thought it was sonographer.
Sonographer.
Thank you for correcting me after all those years. Awesome. So what got you into becoming a sonographer?
I actually, it's a funny story.
Oh, is it? Okay.
Yeah. So
Let's see.
in the summer after finishing 8th grade,
Okay.
the show 16 and Pregnant came on.
Hey, okay.
Yeah,
That's
and
a cool
so
show.
I was watching the show, and one of the girls was going in for an ultrasound.
Okay.
And I just, from there on, I was like, wow, that is amazing. That you can see, specific body parts, your internal body parts. It's like, wow, it just, from there on, I was like, that's what I want to be. That's what I want to do.
From 16 and Pregnant.
Yeah,
That's interesting.
I know.
And so, well, when did you start the program? Because the program's how long?
The program is 2 years.
And so you started it sometime after high school. Like it was like how long after high school?
No, I took a break because I wanted to go get my bachelor's in radiology first.
Okay.
But then I wanted to, a university is not for everybody.
Okay.
So
No, that makes
I
sense.
was like, I'm gonna do something. I have my son, so I was like, I need to do something fast, and I know that's what I want to do.
Awesome.
So then I did my research, and I found Casa Loma College,
Okay.
and yeah, it's an
Where's-
associate's degree. It's in Van Nuys.
I've heard of Casa Loma. They do LVM programs there too, right?
They used to, yeah.
Oh, not anymore?
No, I think they're just starting it up. But now they do have a RN to BSN program now.
Awesome. So you went to Casa Loma and you're like, hey, I want to take this program.
Yeah.
Did you have to take like an entrance exam? Or
Yeah,
how
you
did
do
that-
they have an entrance exam.
Uh-huh.
It's math and English, but
Okay.
I was scared because I was like, I'm not good at math,
Okay.
but it was easy. And they give you a calculator, so you know.
Hey, you got the
Yeah,
calculator? Alright.
yeah.
And so you got into the program. Is there any like prereqs? So like I know like West Coast, right, does nursing, and you have to do like prereqs in order to get in that program. Is it
Yeah.
kind of the same with yours, or how does that?
It's actually pretty simple. You just need your high school diploma.
Okay, nice.
Yeah.
And so obviously the program costs money. So how much did that program cost, if you don't mind saying, and how were you
It's
able to
about
afford it?
$42,000, and I was able to afford it because I took out.
$42,000?
Yeah.
That's a lot of money.
Yeah, I
And,
know.
and so you took out a loan?
So I took out a loan
Or-
through FAFSA, but
Awesome.
FAFSA also gave me a good amount of that,
Okay,
and
so
I also qualified for a Cal grant and
nice.
a couple grants. Yeah.
So I know someone might see this career and they see you and they're like, man, I want to do that.
Yeah.
But then they see the price tag.
Yeah.
So what would you say to someone that's kind of scared of that price tag and is like, oh man, like I don't like. What helped you kind of jump off the edge and say, you know what, this is my education, this is my career, I want to do this?
Yeah. For me, it was because I knew like this is what I want to do, and at the end of the day, you're gonna end up spending a bunch of money with whatever you decide to do. So I was like, am I going to spend this 42 or am I going to end up, you know, going a longer route and spending even more money? Okay. So I went that way.
That's awesome. And so you're taking this class, you're taking this program, and you get a cert at the end, or a certificate, or some type of completion. What is the licensing or certificate for this position or this profession?
After finishing this program, you get an associate's in diagnostic medical sonography.
Okay.
So an associate's in science, and then with that. And then after that, during your externship, halfway through, you can take your AART if you don't have your bachelor's.
Okay.
And then after your AART, and after you successfully pass that, you can take your ARDMS in whatever you want to specialize. For me, I want to specialize in OBGYN.
Okay.
So I would take that and after my AART.
So that's interesting. So there's different, I guess, certifications or specialties. So like I understand sometimes sonographers.
Mm-hmm.
Sonographers either do like OB or they can do like things with DVT, right? Like
yeah, vascular.
So how does that, like, where does that differentiate, or how does one specialize?
Well,
is it just from taking
you
that?
can, yeah, just from taking, well, in the program, you take vascular, you take your physics, you take OBGYN, you take abdomen. So in that program, you kind of get a feel for what you want to take, and it's 15-week semesters. So for me, it was like, okay, I took those and I was like, okay, abdomen's all right, I can do that, you know. But for me, it was like, for sure, OBGYN. And then with vascular, it's like, it's a lot to do with like your blood vessels, you know. So it's like, it's not hard. It's not. It's just a lot.
So then let me ask you, because I worked in a hospital emergency room, and so I was drawing blood in the emergency room, and they would have sonographers come in and out all day, but in the emergency room, it's kind of like a smorgasbord of different conditions. So like you have people coming in and they have deep vein thrombosis, and then they have, you know, pregnancies and things like that. So if you're that type of sonographer?
Yeah.
If you're that type of sonographer, do you have to have all these certs in order to work in the emergency department? Or does it kind of depend on the hospital? Or how does that?
Don't believe so. Because, I mean, that for sure I would have to like look into, but no. Actually, no, scratch that. I do know that. No, you don't need it, because like when you work at a hospital, you just have to be certified in one thing, and then you're you're known as like an ultrasound 1.
Okay.
Ultrasound 2 would be like if you're specialized in OB and vascular.
Okay.
But you can do it all. I mean, if you're trained for it, no. But it's just a different transducer is what.
Interesting.
Yeah.
So you're specializing in OB. So when you get out of this, you're going to look for a job in OB, or would you look for a job in a hospital that's like general? Like, where would you start coming out of school?
Honestly, I'm going to start wherever they hire me.
That makes a lot of sense.
Yeah, because you want to just get your foot in the door and then be able to grow from there, you know. Because if you start to be picky, you're going to have a harder time finding a job.
Okay. And then, so the class that you went through, how many people were in that class? Is it a pretty, like, is it hard to study? Were you able to put study groups together?
You can put study groups together. Not everybody, you know, studies that way. There's about 18 of us.
Okay.
We were one of the largest classes. Before that, they had like maybe 8. It really just depends on how many people sign up for that term. But we tried to do study groups, but then we just kept talking. It's a lot of girls, you know.
I saw your Instagram stories. That's how I knew you were doing this. And you guys were like taking naps in the parking lot and like messing with each other. Like, is that?
Yes. You become a family. Like, you know, you go through everything together, and you even, you know, when one of your classmates is, you know, suffering and they're like, oh, I'm not gonna make it, like, you help them, you know. Because you start together, you're gonna end together, and you gotta put them through it, because if not, like, you get held back, and you don't want them to get held back. You know. Yeah. These are people that you start. It's 2 years, you know.
That's a long time.
Yeah.
So my phlebotomy course was only like a few months. It was only like a couple weekends. So it was like nothing compared to what you're doing. Yeah, phlebotomist. It's very basic training, but it's nothing like that. Like, you get an associate's in, you said radiology? Or
in ultrasound.
In ultrasound, yeah. So, like, that's a lot more education than I have.
Yeah, see, I can't stick somebody. No, I can do blood, because there's, you know, sometimes we'll scan somebody, like a transvaginal scan is one that goes, yeah, that one. And sometimes if the woman is menstruating, like, you're gonna see blood. I'm okay with that. Sticking somebody with a needle is where I'm like, I don't know.
Really? See, I don't know if I can do a transvaginal scan, but I can stick someone for sure.
Yeah.
Wow, well, that's cool. That's interesting. I'm learning a lot already.
Yeah.
So what study tips, like what would you do to study? What kept you motivated throughout this program?
Oh, my friends, definitely. Like, the girls in the program, like, I'm one of those type of people who likes to doubt themselves through, like, every semester. Like, nope, this is going to be a semester that I'm going to have to be held back. But, like, even though it wasn't, true, like, and they would always be like, no, you got this, we can do this, or like, awesome. But Quizlet is what saved my life.
Quizlet, I love Quizlet.
I owe my associate's degree to Quizlet. Thank you so much.
Quizlet, if you guys don't know what Quizlet is, go Google it. It's Quizlet.com, I think. And you can find, like, flashcard sets. I tell my students to do this all the time, but people have either gone through your program or taken similar programs, right? And so it kind of takes out the work of you having to do that. And then also, not only is it flashcards, but it's like tests. Yeah. And like the memory game, or like, it has
the
different
games,
like things, right?
Yeah.
That's pretty cool. Okay, so this program, was it as hard as you thought it was going to be? I'm sure it looked daunting in the beginning, but was it really that hard?
No, in the beginning I was like, oh, it's going to be a breeze.
Oh, really? Okay.
I'm so interested in it. And after this, I was like, oh. After physics, I was like, do I really want to be?
Did you take physics in high school?
No, I didn't.
Okay.
How do you think I got those free periods? Skip.
That's true. Okay, so, all right, so you said it was hard. It takes a lot of motivation. Like, there's a lot going into it.
It's more like personal discipline.
Right.
Because you can do it. You really can. Like, honestly, like, being a single mom and having a toddler, like, if I'm able to do it, like, my son would go to sleep, and I would take that time to, like, do Quizlet.
That's a great segue, because that's what I was going to ask you next. Being a mom, I'm sure there's a lot of young moms out there who, feel like they need to do something more, or like they want to go back to school, but they're afraid because they do have a son. Your son's 4 years old.
Yeah.
Son or a daughter. He's a kid. He's in preschool or kindergarten.
He's gonna start. Yeah.
So like, that's very daunting. So how did you manage being a mother and going to school?
It was hard. It's really, really hard, because it's, having to find a babysitter, or like having to sacrifice a lot of your time. And like, luckily my son's young, but it was really hard to like be like, okay, well, I'm sorry I can't, take you to the park right now because mommy has to study.
That breaks my heart.
It's really hard, but it's so worth it. After the 2 years that you finish, it's like, okay, now I can give my son that better life. Awesome. So it's a bittersweet thing. It's like, oh, like, I wish I would have spent more time with him, but then it's also like, now I get to give him that time, because I can provide that for him,
That's awesome. Yeah, my mom is an LVN, and we when I was like 8, she was a single mom, and she kind of, she was still with my dad at the time, but they were going through whatever struggles in the middle of it, and so by the time she graduated, she was single, but she, through, the separation and taking care of me and my 2 sisters, and she had 3 kids, you only have 1. Like, I can only imagine, and that's also a 2-year program. So I can tell you, coming from a single mom who's gone through a program like that, I really barely remember my mom being in school. And I was like maybe like 8, so even less will your son will remember. And it just seems so seamless. And looking back on my mom now and see where she's come from, and seeing the struggle she went through, and the house that she's able to buy now because she went through that program. If she didn't, she would have still been a medical assistant. But she took that step to advance, and I can see you being where my mom is, and that's awesome. I see a lot in your future, because that's great. That's awesome.
Yeah, it was just it just takes a lot out of you as a person to like be able to like, okay, I have to put my son aside, but this is gonna end up paying off at the end, and it's worth it. It's worth all the heartache and all the struggles, because I mean, it's life. You go through a lot of, like, personally me, through my 2-year program, I actually went in for surgery, or like an outpatient procedure, and I ended up having a heart attack.
Really?
So yeah, and then I had to go back in.
You did not put this on your Instagram story.
You think I won't be? They'd be like, oh, you had a heart attack.
Wow.
No,
okay.
I mean, 24 years old with a heart attack. That's not appealing.
Wow.
But like, you go through things in life, and like after the weekend, I had to go back to school and take a test.
Wow.
So there's, it's just a lot of things that you go through and you think, I can't do it, or how am I going to do it? And it's like, you can do it if, you just don't want to wake up and be like, I should have done this or I should have done that. And it's like,
taking that leap
shoulda,
of
coulda,
faith.
woulda, do it now, and
awesome.
take those 2 years to get your degree.
Wow, yeah, so if you're watching this, you have no excuse really. And if you have a bigger story than a heart attack at 24, leave it in the comments, but I highly doubt anyone's gonna top this. Wow, I had no idea. That's amazing. I mean, your story was already amazing, but now you have all that to add on to it. That's crazy.
Yeah.
I'm speechless now.
I know, I'm sorry.
I don't even know how to follow. You
Drop
just like
the
dropped the bomb. Like that.
By the way.
And I'm over here with my phlebotomy cert. And what am I doing here? I can't. Wow. Okay. So back on track.
Yes.
So we're talking about it. We're in the middle of the COVID, pandemic, and you were telling me that you haven't finished your clinicals yet. Your extern. Yeah. What happened? Were you set up for it, and then March happened, and then?
I was actually in my OB semester, which is the last semester you take, and we were about to finish. And then they were like, well, sorry guys, but it looks like you're gonna have to go home and take your final. We'll email you guys basically type thing. And it was basically like 2 or 3 weeks before finals. So so then we had to just basically finish the course online, and then we went back in to take our final exam. And then after that, we had to go back in to take our exit comps, which are 3 exams that you take in order to graduate from the program, basically. And it's just knowledge that you've learned over the 2 years.
Wow.
Yeah.
What was scheduled for your externship? Like, what would you have gone through? What was that going to be like for you?
So after passing the 3 exams, I would have started at Valley Pres. I would have started 40-hour weeks or 40-plus hour weeks.
What's the amount of time that what's the required externship hours?
I believe it's almost 1,000 hours.
1,000 hours?
So it's 6 months.
Okay.
And about 1,000 hours that you got to do, and then you graduate. But
is there a certain amount of rotations or scans that you have to do?
There are other exit scanning comps that you do have to do in the hospital, just to prove that you know what you're doing, because they don't want to give you your associates and you get a job, but then you don't know what you're doing. That would be disaster. So so you have to show to whoever you're shadowing that you know what you're doing. You're capable of being an ultrasound sonographer. And it gets sent to your school. The program director checks it off basically, and then you get to finish your externship.
Awesome. So you would have gone to Valley Pres, which is one hospital here in the Valley. Do they send you to any other hospitals, or is it just that?
Yeah, there's a bunch. There's actually some in Santa Clarita. I'm not sure, but there is a clinic out there that does.
Okay.
And they travel to Apple Valley.
Wow. That's out past Lancaster, right? That's crazy.
So there is that place. There's also Northridge Hospital.
Okay.
There's Mission Hills, but Mission Hills only takes people who have their SPI is another certification that you have to take. Your SPI, a bachelor's degree, and then you have to pass their interview. Not all of them have strict, interviews, but.
So if you want to continue, if you want to advance as far as your bachelor's degree goes, where would you do that? Would you do it at Casa Loma again, or would you go to a university, or how
I would probably. My plan is to go to CSUN and do their radiology program. I haven't quite found one that does a bachelor's for ultrasound, but with ultrasound, if you get your radiology degree, then obviously the pay is more and you get to advance in your career. You can be I don't know how you can put this. It's you're like a supervisor is what you can be. Yeah. So
when you say radiology degree, would that mean you'd become a radiologist, or
you would also become a radiologist? So then you'd be
so you don't want to do ultrasound forever?
I do, but
you could.
More money.
Yeah.
Why not?
So that's interesting. So when I got into phlebotomy, I was introduced to all the other laboratory career fields that I had no idea of. And so I guess your department is imaging, right? Radiology and imaging. Is that how you describe it?
Yeah.
What other opportunities have you found, or like have you discovered and you're like, wow, that sounds interesting? Because I know there's like MRI, right?
There's
radiology tech. Like what else?
I know, like, I think that's kind of basically it.
Yeah.
There's just a lot of like, you can get a CT, MRI, stuff like that. Nothing really caught my eye. I've always kind of wanted to do ultrasound, so I'm pretty sure I'll just stick to that. If I do get my bachelor's in radiology, it'd be just to have a higher pay, to be honest. But yeah, just that. And then also too, you don't quite need to get a bachelor's. What they really look for is, your certifications, what you're licensed in. So if I'm licensed in OB and vascular, that's gonna put me at an ultrasound 2. So it's higher pay. So
nice. And so you talked a little bit about pay. So what can an entry level sonographer expect to make in the field?
We were told about 70, 80 plus.
70 plus? 70,000?
Like 70,000 or 80,000 plus.
I thought you were saying an hour.
Oh, no.
No, but that's still good.
As to start, we were told, like, I think the lowest was like 20 to 25 to start an hour. But that's because you don't have experience. Yeah. Like, you did your externship, but
you're in Los Angeles, you're in Los Angeles County.
Yeah.
And you probably make more than you would make more than any other tech in, the country.
Yeah. Well, yeah. But it also has to do with like supply and demand too. Oh, okay. So like, let's say if I want to go and work in Chicago and they like really, really need an ultrasound tech, they're gonna pay.
Right.
We do have somebody from a previous class that had graduated and actually is working in Chicago, and they are paying him living expenses, everything. So he moved out there. He's getting really good pay. Like, it really just depends on where you work. And
so there's like travel. I know there's like traveling nurses. I know there's traveling phlebotomists. I'm sure there's so that's what you're talking about. To travel.
No, he actually moved out there to work out there in that hospital in Chicago.
And he's staying.
to live. Yeah, he lives out there.
So he works for the hospital, not an agency, or
no, for the hospital.
Wow.
Yeah, but there are agencies too that travel as well, and that is actually good money as well.
Have you looked into like the job market? Have you seen? Like, have you gone on Indeed or like these different and like seen?
They're always hiring for ultrasound.
So you said OB, but like if you could pick like a hospital or a healthcare system, is there somewhere that you said like I want to work there? Like when I started, I was like I want to work at Kaiser, right? So that's what I thought was like the pinnacle.
Yeah.
But in doing more, like where I'm at now is way better where I was before. So have you looked? I've
thought about Kaiser actually, just because I know like the benefits and stuff. I wouldn't mind Mission Hills. I gave birth to my son there, and that hospital is like the cleanest hospital I've ever seen. Okay. Yeah.
Wait, Mission City or wait? Which?
No, right here on
Holy
Providence.
Cross? Oh, Holy Cross.
Is it?
Holy Cross.
I've been saying Mission Hills, huh?
No, it's Holy Cross. Yeah.
It's in Mission Hills. No,
that works. I used to work there. That's why I was in the emergency
Providence,
department.
Holy Cross.
That's awesome. Yeah, they get all their traumas there. So
yeah,
I really like.
I love that.
But you said you were scared of blood. You said you didn't like sticking people.
Yeah.
Okay.
I don't know.
But you can see it.
Yeah, I can see it.
Okay, that makes sense.
But I can't. Yeah.
Awesome. Oh, now I remember what I was gonna ask. So, you said you do get the certificate. Do you also need to apply for a state license? So we're in California. So like I have to have my CPT 1. I know nurses have to apply for like their California, board. Is there like a California license that you would have to apply for, or like certification, or is it just like a national certification?
It's the ARDMS.
And so that's national. So you can go anywhere. What does that stand, or what is that organization? So if people want to Google it.
Just search up ARDMS.
ARDMS?
It's long. Okay. It's long. It's
like
Association of. It's long.
Okay.
But it's ARDMS.org, I believe.
And so they accredit you, and then are there continuing education credits after that?
Yes. So you have to do. Don't quote me on this because I'm not sure, but I think it's like 20 or 30 credits that you have to do a year.
Okay. I'm going to do 6.
We're not talking about you right now.
Okay,
just kidding.
That's a lot of credits. Every 2 years? Every year?
I don't know if it's every year, every 2 years. See, we didn't really talk about that.
Okay.
I don't really tell you about that.
No
but you can get them from like going to like a conference or buying a book.
Okay.
Made by ARDMS. Like it says it in the back. Like, this is 3
there's like
credits.
online modules and stuff like that.
Yes.
Okay.
So it's not hard.
And then a lot of things is that you can do that like through your employer, right? Because like for us in laboratory, like we're on compliance like stuff, and so every year we accumulate those credits. So I'm assuming it'd be the same.
Yeah.
What advice would you give to someone who's starting this program?
Don't wait until the last minute to study.
Okay.
So with this program, the thing that I really liked was that they will print out their lectures for you, and they go through the packet with you, so you can jot down your notes. I suggest that you read those every night, because believe it or not, even if you think, I don't even remember, after you finish reading it, you're like, I don't even remember what I just read. Like, trust me, your brain will remember it. Also, what really helped me was explaining what I learned to somebody else.
I've heard that helps. Like if you can teach it, right? If you can teach it, then you really know you've got it.
Yeah.
So like, who would you explain it to?
My son.
Your son? Oh, that's so cute.
I was like, okay, today we're gonna read a story. I'd pull out my physics book,
and he's gonna be like scanning people. That's awesome.
No, like I had to learn the whole menstrual cycle.
Okay.
And that was tricky because it's like, no problem. Thanks. Your ovarian cycle and your menstrual cycle, like they, coincide with each other. So it was a lot. But I was like, anybody who wants to listen, I'll tell you how the menstrual cycle works. But that helped me a lot, is being able to even if you get it wrong when you're explaining it, keep doing that. And then obviously Quizlet as well. Start on that, because it takes longer to make the Quizlet than it does to study it. But yeah.
If you could think back to your worst day in the program, is there a worst day? Like, can you think of a worst day?
My worst.
Or maybe a day that got you to the point where you're like, you know what, I want to quit. I don't want to be here anymore. Did you ever get to that point?
Yeah.
Yeah. What do you think contributed
to think of
to that? Like, how can someone avoid their worst day? Or how can they get over their worst day?
You can't. Oh, you can't avoid it.
You can't avoid it.
But you can get over it.
How did you get over it?
You can just realize that you're doing the best that you can, and because you do get stressed out, during the program, because it is a lot. It's a lot of information that you have to learn. But a way to get over it is just realizing that you did the best you could, and whatever the outcome is, you just have to go forward with that and just realize, okay, like let's say I would have failed, the whole entire semester, then just literally pick yourself up and just, dust it off and be like, okay, I'm going to continue to do what I have to do to make sure that I finish this program.
That's awesome. Okay, so to come out of that, what was your best day in the program? Can you think of a day that you're like...
When I got that email about graduation.
Hey, so they emailed you and said congratulations.
Yeah, they were like, make sure you RSVP. And I was like,
awesome.
Do I really have to? I'm going to be there.
When's your graduation? So your graduation ceremony
is in September.
Oh, so it's a little ways away.
Yeah.
But so you're kind of waiting though. You're in this limbo of
yeah, but because of,
because of COVID.
Because of COVID, yeah. Not because of me. No, I did it right.
You could do it. Awesome. So let me ask you this. If I was pregnant right now, would you be confident in telling me if I had a boy or girl?
Yeah.
You could tell?
Oh yeah.
How can you tell? How does that can you give us without any displays, if you can give us the best explanation, how do you see a penis or not?
If it's a boy,
it
will look like a turtle, like its head coming out of the shell.
Really?
If it's a girl, it will look like the M on McDonald's.
But you're looking at a bunch of lines and
so it's a 3-line sign for the girls, but they call it the McDonald's.
Okay.
And for a boy, it's not really as... I was about to use some ultrasound terms, and it's not echogenic.
Oh, okay.
It's not hyperechoic. It's not bright. It's not as bright as you seeing the 3-line sign on a girl, and nothing's poking out like that.
So to you you're educated in this, it's pretty obvious. You can look at a picture and be like, I know what that is. So on your first day when you started seeing these pictures, were you like, how the hell am I going to read that?
Yes, because you have to train. So throughout this whole program, you're training your eyes to see grayscale. That's all you see is just a bunch of different shades of gray.
Yeah.
So my first class, when they first, well, not my first class, but when they first took us up to the lab, and they like were showing us a scan, and I'm looking and I'm like, what is that? Like,
Yeah.
somebody was like, it's a baby, like, you know, just to mess around. But he's like, no, like, that's your gallbladder. And I was like, what? What is that? Like,
And I forget about that you can, like, there's other organs
Yeah,
like,
yeah.
that are involved. It's not just about pregnancy.
yeah. And that's a common mistake that everybody makes, because even my mom, like, when I was like, hey, you know, like, you're having some pain, like, let me scan you. Like, I can't tell you if you have something, but, you know, let me just scan you. And she was like, but I'm not pregnant. I'm like, that's not what I, no, like, you can scan so many other structures. Like, I can see your arteries, I can see your veins, I can see your heart. Like, there's so many other things. I can see your liver. Like, if you are a big drinker or you have diabetes, I can somewhat tell from your liver, because your liver becomes fatty, like, and you can see that.
Yeah. So when I was like 9 or 10, I was diagnosed with fatty liver.
Really?
Yeah, and I actually went in for an ultrasound.
No way.
When I was like 10 or something, and I was so confused at it.
Yeah.
I mean, I'm still alive, so I think I'm okay. But no, for the like last few years, my ALTs were like at 200, and so they were really like, I don't know if I'm okay now, but like since I started working out, they've gone down.
Yeah.
But yeah, that's where I first discovered like, oh wow, you can really do this like with other organs. So what about 3D ultrasounds?
Oh,
What's like
favorite?
So is that like a special cert? Like how do you get into 3D ultrasounds?
It's the same thing.
Yeah?
It's a button on the machine that you just 3D.
Yeah?
Yeah.
So we've been able to do this forever? Like it just this
Not
isn't
forever,
fairly new? Okay.
just because like it does take like they did have to, you know, invent it and put it into the machine. But other than that,
Software
like
updates.
yeah.
And it's based off of the amniotic fluid, right? So like
So like
the more fluid, the better of a picture you get. Is that
not too much, because if you have too much fluid, it's polyhydramnios, and that's not good for the baby.
interesting?
Yeah. But
Hey, I'm
yeah,
learning-
so we measure
I'm
fluid,
learning
you
a
know.
lot.
Yeah.
Okay.
Yeah. You don't want to be oligohydramnios either, because that's a little bit, and you then your baby can't, you know, is restricted. You don't want them to have IUGR, so
What is IgU?
intrauterine growth restriction.
Okay, it's interesting.
Yeah.
And so is that something that is that still considered OB, or like when you think of OB sonography, like are you thinking sonography?
Sonography.
Sorry.
It's okay.
What like is that just telling gender, or is there so much more to that? Because
There is so much
right,
more to that.
So like, as a technician, like you would be able to see things in a pregnant woman or for the fetus, but you're not allowed to say anything, right? Like you can't.
Even
Is that
though we
something you guys
know
talk
what
about?
it is, we
Like ectopic pregnancies, right? So
Yeah.
like that's something that you'd be able to tell.
So definitely,
but
yeah.
you can't say any,
No,
right? So how does that?
Well, it's kind of hard, because you know you have to make sure you keep a straight face. You don't want, because your patient, especially if they're worried, they're gonna be looking at you to get any clues, because they can't see the screen. So
yeah, you gotta work on your poker face.
yeah, I'm
Yeah.
trying.
Wow.
But you can tell if your baby's head is too small, too big, if they have fluid
So,
in
like,
their brain.
deformities?
Yeah. Oh, definitely.
Really?
Yeah, because I
didn't know.
can measure the baby's femur to see if they're growing at a, you know.
That's so sad.
Yeah, I know. So you can tell if the baby is alive or not, because you
And you
can.
see the heartbeat.
Yeah.
That's right.
You can measure the heartbeats as well to see if they're, because if your baby has a heartbeat, not to scare anybody, but if your baby has a heartbeat and if their heartbeat is not fast enough, then that's an issue as well. So we can tell if you're dilating, you know, before you should, because
Is it like a trans vag?
it doesn't have to be trans vag, no.
Okay.
You can.
Oh, because you're looking at the cervix, right?
Yeah.
Right, so you're like, okay.
But you can do trans vag. It's a better window, but yeah, you can tell. You can see a lot of things, and for the most part, you know, you can tell what it is. Obviously there's a lot of things that look the same, and like, I mean, a lot of like deformities that look the same, or you know, and you don't know until you get an actual test for it. But for the most part, we can tell if you have gallstones or kidney stones, or if you have an enlarged liver, but we can't say anything because we're not doctors, you know. Yeah, we may make the job easier for a doctor by telling them what we see so that they know, but we can't say anything. We're not allowed to.
If a pregnant woman is going for an ultrasound, obviously everyone thinks they're there for the gender, right, and the heartbeat. But is there like a checklist of like what,
Oh, yeah.
like, so how do you run down that checklist, or like if you give us like a brief preview on
Yeah.
like, that checklist that you're running down?
So it really depends on the hospital's protocols, but for sure you have to measure the baby's head. You have to measure the baby's abdominal circumference, their femur. Depending on how far along they are, crown rump length, which is from the head to the feet. You can also, what else? Check their kidneys. A lot of people like to check their, well, they don't like to, but they have to. They should check their umbilical cord to make sure that it's a 3-vessel cord and not 2. Yeah. Yeah, it's a lot. But yeah, so you have to make sure that you check through those things. Make sure that you measure the fluid to make sure that the baby has enough fluid to move around. If they have twins, you have to make sure that there's things called like a stuck syndrome, or they like to call it Pancake Syndrome, where one baby will get squished up upside the amniotic wall and gets squished by the other baby, and that baby unfortunately passes.
Oh.
Yeah, so there's things like that, or if there's one where like if you have it's called twin-to-twin syndrome, where one baby is benefiting off of the other baby. But you can tell a lot of things there, but it really just depends on how far along you are, and like if you're high risk too.
Interesting. During your program, you guys probably did some ultrasounds on each other, right?
Yeah.
Scans
Oh
on each
yeah.
other. Did anyone find out they were pregnant in the program?
No.
No? Okay.
No.
I
know it was no, but it was a joke
like,
that we were all like
what?
18 of us, and we're all good.
Wow. Okay. So I imagine that this career field is pretty female dominated. Yeah. Or is it pretty evened out? Because I feel like nursing is now evened out.
It's pretty female dominated,
Were there
only
any guys in the
because
class?
there was one.
Okay.
Mainly female like dominated, but there are some males. The only thing is that when you do scan, if you're scanning a female patient, you're gonna have to have a person be there for you, like a nurse or just someone who works in the hospital.
A male can't do a transvaginal.
You can do a transvag, but you have to have somebody there with you.
What if you're just doing a normal scan? You still have to have someone there with you?
If it's female.
Yeah?
Yeah.
Okay.
You should always, if you're a male and you're an
Especially
ultrasound.
liability, yeah.
Yeah, that's basically what it comes down to. But yeah, so it is like female dominant.
Okay.
Yeah, it's funny because when we're scanning each other, like we can find things on each other. Like I found this fibroid on one of our classmates, which is like in your uterus and stuff.
That's kind of scary.
One of the classmates found a cyst on my kidney, and that's actually what I went for, to get it drained, and then stuff happened. Yeah.
No way.
Yeah.
So what would have been the result if they didn't find that?
Depending if it still grows, it could pop and give me an infection. But if it's a simple cyst, so which means it's just fluid filled. If it's super big, then they try to remove it so that it doesn't pop and give you an infection. If it's small, then it usually goes away on its own.
Wow.
It's still there, by the way. It came back.
So you have to go back and get that drained.
I'm not going back.
You're not going back?
No. It's small enough now to not cause a risk.
Are you going to scan it every now and then?
We do actually.
Yeah?
Every time like we had class, like it'd be like, let's see how it's going.
Did you give it a name?
No.
Imagine. Just give it a name. Wow.
No.
All right. Well, I feel like I've answered all my questions and my curiosity has been filled. Stacey, thank you for being my first interview on this channel, Allied Health Mentors. Check us out on Instagram, Facebook, and I think YouTube. Well, we're on YouTube. Or this is going to go on Instagram too, but check us out at Allied Health Mentors. With Stacey, I applaud you. You've been through a lot.
Thank you.
You're definitely a role model. You're a gentlewoman and a scholar. And a
Thanks.
role model to all the women out there. If people want to know more about your career field and where you're at, where can they find you? Do you want people to follow your Instagram?
You can email Eddie.
You can email me, or you can follow me with questions or ask me questions, and Stacey will answer. Also, we're gonna do an update. I'm sure. So after your externship, I want to hear how it went, and then like when you get a job, I want to hear how it's going.
Yeah.
I want to keep up with you.
Yeah,
and
of
then see
course.
where this is at.
You know, I'm not leaving somewhere, so.
We're going to stay in. I don't think I am either. So if you're in.
If I haven't left now.
We're staying here forever.
We're stuck.
We're just going to get old here. Guys, if you're in or around Los Angeles County and you're an allied health professional and you want to do an interview like this with us, go ahead and leave a comment, send me a message, Instagram, Facebook, at Allied Health Mentors. I want to bring more exposure like this to the world, to hopeful students and prospective, professionals, so that they're not so scared. They have an idea of what to expect going into these programs and into these career fields.
Yeah.
Do you have anything else you want to say before we go?
I just think that being able to do an interview like this really does help out even the community itself.
Chicano pride.
Yeah, exactly.
Chicano pride.
You want to be able to help out everybody, and that's the purpose for these interviews, to not scare you, but to like kind of open your eyes and be like, you know what? If she did it, so can I. So why not?
Awesome.
What's stopping you?
I think that's a great place to end it. It was very inspirational. I might check out this program. Thanks for tuning in, guys. Allied Health Mentors. We'll see you later.
Bye.
Bye.